Welcome to Learn Medical Spanish. In this episode, I'm going to go over a dialogue or a series of phrases you could use to talk about a urinary tract infection. In other words, if a patient comes in and they're saying, I think I might have a UTI, or they just have a symptom like burning with urination that often represents a UTI. So you could kind of use it either way because both of those scenarios happen a lot, right? Okay, so let's go ahead and get into the phrases. I'll say each one in English first, and then I'll pause so you can think about it a little bit. And then I'll say it in Spanish a couple times, and ideally you would say it out loud each time that I say it in Spanish, so you can get that practice. Because the hardest part about speaking Spanish is speaking Spanish. So to actually say it out loud is how you really get the practice that counts the most. All right, so here's the first phrase. Does it burn when you pee? ¿Le arde cuando orina? ¿Le arde cuando orina? And by the way, we're using the usted form for all of these questions, which is the form you would typically use with your adult patients, so with most of your patients, unless you're a pediatrician. All right, the second phrase, how many days has it been? ¿Hace cuántos días? ¿Hace cuántos días? FYI, sometimes the English phrase might sound a little weird to you as an English speaker because I started with Spanish and then I translated it into English basically. So if it sounds weird, that's because we're phrasing it the same way we would phrase it in Spanish. All right, next phrase. Have you had a UTI before? ¿Ha tenido una infección urinaria antes? ¿Ha tenido una infección urinaria antes? And there are other ways you could probably ask that, right? You could say, like, have you had a bladder infection? So it would start the same if you say, ha tenido una infección de, or actually, it starts the same, ha tenido una infección, but then you'd change the part after that, de la vejiga, por ejemplo, of the bladder. All right, next phrase. Were the symptoms similar to these? In other words, when they had the UTI before. Were the symptoms similar to these? ¿Los síntomas eran similares a estos? ¿Los síntomas eran similares a estos? Do you feel pain in the abdomen? Again, that sounds a little funny in English, but that's because it's more like Spanish. Do you feel pain in the abdomen? ¿Siente dolor en el abdomen? ¿Siente dolor en el abdomen? Does your flank hurt? ¿Le duele el costado? ¿Le duele el costado? Quick pronunciation tip. Notice I didn't say costado, costado. That's how a gringo would say it. But the D is not a hard D like English. It's very soft when it's in the middle of a word. It's more like a TH. So costado, costado. All right, next phrase. Do you have fever or chills? ¿Tiene fiebre o escalofríos? ¿Tiene fiebre o escalofríos? And if you prefer, you can split that up and just say, ¿Tiene fiebre? ¿Tiene escalofríos? Whatever you're more comfortable with. Next phrase. Do you have discharge from the vagina or penis? So of course you're just going to pick one or the other, but I'll say both. Do you have discharge from the vagina or penis? ¿Tiene flujo de la vagina o pene? ¿Tiene flujo de la vagina? Or you would say, ¿tiene flujo del pene? So I went ahead and divided that up. So, so it's just, it should be obvious that you're just going to pick one or the other. All right. Next phrase. Do you have a rash on your genitals? ¿Tiene erupción en los genitales? ¿Tiene erupción en los genitales? Have you had an STI in the past or an STD? ¿Ha tenido una infección sexual en el pasado? ¿Ha tenido una infección sexual en el pasado? And of course, at that point, you could go down a whole rabbit hole about sexual history and stuff, but we're not going too far with that because this is just about UTIs. So the next question is going to be, are you pregnant? ¿Está embarazada? ¿Está embarazada? When was your last period? ¿Cuándo fue su último periodo? ¿Cuándo fue su último periodo? There are other words for period or menstruation, such as regla, su última regla. I guess in some countries they kind of think that's a little too informal, but that's what that means. And then there's also the word menstruation, like menstruación, menstruación. So you have some different options there. Okay, so that was a dialogue about UTIs for a Spanish-speaking patient. And if you're on YouTube, you can see a couple of playlists here. One of them's about a lot of other medical Spanish dialogues, sort of similar to this one, but about different topics. And then on the right side, you can see a playlist that goes over a bunch of Spanish anatomy for different parts of the body. So super useful to know if you're dealing with any medical Spanish clinical scenarios and whatnot. Thanks for watching or listening, and I'll see you next time on Learn Medical Spanish.